You know, like all research and clinical services, the study was significantly impacted by the pandemic. Recruitment was going really well up until the declaration of the pandemic, and our study was a completely centre-based, face-to-face trial. We had designed it based on the existing clinical pathway, so the study touch points in terms of the assessments were all points that the patients were coming in to see the clinicians as part of their usual care for transplantation. And then obviously many of those appointments were changed to being telephone, and for a short period transplants themselves were paused. So our study paused. We really thought that patients or participants that were in the study might want to drop out in that time that they were waiting for transplant, but what we actually saw was participants wanted more support to be physically active, particularly in the context of shielding and isolating at home. It actually became more important for them to have support to focus on some of the self-management they could do at home in that time that they were waiting. And obviously when we all realised that the pandemic wasn't going away quickly, we applied for a substantial amendment to the study to allow us to deliver it remotely. So that included changing completely to remote enrolment and consenting, changing our assessments to be use measures that we could do remotely. So unfortunately for me as a physiotherapist, we had to lose some of the objective measures of physical function that we had incorporated into the study design, mainly because they weren't possible to do in a remote delivery. So we were able to maintain a number of the measures, including the time sit to stand test, which had proved to be really useful over the course of the study. But things like the 6-minute walk test we weren't able to maintain. In order to ensure safety, we had to incorporate some other measures. So we started to screen patients using a fall screening questionnaire, and that was just for us to be reassured that having not seen patients in a face-to-face manner prior to starting an exercise program, that we were confident that it would be safe for them to exercise at home, being virtually supervised by the physiotherapist. And yeah, the intervention itself changed dramatically in the prehab phase from being a session where they came into a gym and worked with the physiotherapist. Patients joined at home, again in a group setting, in that a number of them were on Zoom together while the physiotherapist supervised and led the exercise program. But a real positive of all the change was that we now have enough data to indicate that that's really acceptable, safe and feasible for us to do. And so our hope now going forward is that certainly locally we will try and implement some form of remote prehab and rehab into our clinical setting, and hopefully we'll be able to do sort of further research to look at the effectiveness and the efficacy of exercising myeloma patients remotely.